Every year in the United States, 16 million patients get hospitalized after emergency care for an injury or acute illness, and about 25% of those patients later develop problems with depression, anxiety, or PTSD. The American College of Surgeons Standards for Care of the Injured Patient calls for mental health risk screening in Level 1 and Level 2 trauma centers. Dozens of screens have been created to predict who will have later mental health problems, but the performance of only 2 of those has been replicated in new samples of patients, and no screens are routinely used in hospitals. Existing screens also have some limitations. Our approach was novel in several ways. We developed our screen based on data from over 1,300 patients from 3 hospitals across the United States. We included patients admitted for acute illness as well as patients admitted for injury. We included enough patients with ethnic racial identities of Asian American, Pacific Islander, Black, Latinx, multi-race, or white to inform selection of risks and to select items and to test performance within those groups. We also included some risks that are social determinants of health, such as discrimination, and we're conducting a replication study in new patients. Using methods described in the paper, we found that as few as 10 items accurately predicted symptoms of mental health 2 months later in each of the ethnic racial subgroups we studied. If administered on paper, the screen would look something like this, although we expect most hospitals would incorporate the screen into their electronic medical record systems. The next step for this study is completing the replication study. And solid performance in the replication study would mean the screen is ready for use in hospitals across the country, including hospitals that serve patients who are diverse in terms of ethnic racial identity. Screening all hospital patients admitted after emergency care, giving patients information about their mental health risk, and providing at-risk patients with preventive mental health care could increase health equity. We also hope making this screen will foster research on preventive mental health care for trauma survivors. Ultimately, screening and preventive mental health care could reduce suffering and decrease healthcare costs for millions of Americans every year.